Welcome to the complete PTSD deep dive. If you've watched our main PTSD breakthrough video, you're ready for comprehensive information covering every aspect of PTSD from causes to complete recovery. We'll explore 10 detailed areas with the latest medical research and practical guidance for lasting trauma recovery and post-traumatic growth. Progression and health impact. Without treatment, PTSD typically follows a progressive pattern that can significantly impact overall health and quality of life. Initially, symptoms may be intrusive thoughts and heightened anxiety, but they often expand to affect emotional regulation, relationships, and physical health over time. The condition can evolve from acute stress reactions to chronic complex PTSD that permeates sleep patterns, immune function, and overall well-being. The systemic health impact extends far beyond mental symptoms, as PTSD triggers chronic stress hormone activation and inflammatory responses throughout the body. This prolonged physiological activation can contribute to cardiovascular disease, autoimmune disorders, chronic pain conditions, and digestive problems. PTSD increases the risk for heart disease by 55%, autoimmune conditions by 40%, and substance abuse by 75%, as well as significantly increasing suicide risk, making early intervention crucial for preventing these serious complications. However, understanding progression also reveals hope for intervention at any stage. Even long-standing complex PTSD responds well to modern trauma-informed treatments, and the brain's neuroplasticity allows for significant healing regardless of how long symptoms have persisted. Modern treatments can interrupt the progression and often reverse many of the negative impacts, restoring normal stress response and emotional regulation within 4 to 8 months of beginning appropriate trauma-focused care. Underlying causes and risk factors. PTSD results from a complex interplay of traumatic exposure, genetic vulnerability, neurobiological factors, and environmental influences, with no single cause responsible for development. Genetic predisposition plays a significant role, with family history of mental health conditions increasing risk by 30 to 40%. But having genetic vulnerability does not guarantee developing PTSD. Neurobiological differences, particularly involving the amygdala, hippocampus, and prefrontal cortex, contribute to increased trauma sensitivity. Environmental factors include type of trauma, age at exposure, trauma severity and duration, social support availability, and previous trauma history. People who have experienced combat exposure, sexual assault, childhood abuse, or natural disasters are more likely to develop PTSD. However, many people with these exposures never develop PTSD, while others with seemingly less severe trauma do, emphasizing the individual nature of trauma response. Psychological factors encompass pre-existing mental health conditions, coping strategies, cognitive processing styles, and meaning-making abilities. Physical health conditions, substance use, and social isolation can also influence PTSD development and severity. Understanding these multifaceted causes helps eliminate self-blame and emphasizes that PTSD is a legitimate medical condition requiring specialized trauma-informed treatment. Diagnosis and assessment. Professional diagnosis involves a comprehensive evaluation that considers trauma history, symptom patterns, functional impairment, and differential diagnosis. Mental health professionals use standardized diagnostic criteria from the DSM-5 and assessment tools like the Clinician-Administered PTSD Scale, CAPS-5, or PTSD Checklist for DSM-5, PCL-5, to ensure accurate identification and rule out other conditions with similar symptoms. The process typically includes detailed trauma history, symptom assessment, and evaluation of impact on relationships, work, and daily functioning. Clinical interviews and sometimes neuropsychological testing help identify trauma-related cognitive changes and rule out conditions that can mimic PTSD symptoms, such as traumatic brain injury, depression, or anxiety disorders. Many people feel validated during the diagnostic process because it acknowledges their trauma experiences and provides a clear framework for understanding their symptoms. Healthcare providers emphasize trauma-informed care, creating safety and avoiding re-traumatization during assessment. The diagnostic process also identifies any co-occurring conditions like depression, anxiety disorders, substance use disorders, or dissociative disorders, which affects treatment planning and approach. Modern diagnostic frameworks recognize the complexity of trauma presentations and focus on functional impairment and trauma-related symptoms rather than symptom severity alone. This comprehensive approach ensures that treatment addresses all aspects of the trauma response and maximizes the likelihood of successful recovery. Key questions to get the best treatment and outcome. Engaging actively with healthcare providers through thoughtful questions ensures optimal treatment outcomes and builds collaborative therapeutic relationships. Essential questions include asking about different evidence-based treatment options available, expected timelines for trauma processing, and specific criteria for measuring recovery progress. Inquire about trauma-focused therapies like EMDR, CPT, or PE, and whether newer treatments like MDMA-assisted therapy or neurofeedback might be appropriate for your specific trauma history. Discuss potential emotional intensity during trauma processing, strategies for managing between sessions, and what to do if symptoms temporarily worsen during treatment. Ask about safety planning, coping strategies for flashbacks or dissociation, and how to access crisis support. Understanding the provider's training in trauma-specific treatments and their approach to creating therapeutic safety helps build confidence in the healing process. Important questions also include discussing warning signs that would require immediate intervention, how to involve family members or support persons appropriately, and maintaining stability during trauma work. Ask about long-term prognosis, strategies for preventing relapse, and transitioning from active treatment to maintenance care. Inquire about trauma-informed medical care and whether physical health monitoring might be beneficial during recovery. Medications and their effects. Modern PTSD medications offer effective symptom relief with improved safety profiles compared to earlier treatments. SSRIs like sertraline and paroxetine remain first-line treatments, typically requiring 6 to 8 weeks for full effectiveness while reducing intrusive symptoms, hyperarousal, and avoidance behaviors. These medications work by stabilizing serotonin levels to improve mood regulation and reduce trauma-related anxiety. Newer medications show promise for treatment-resistant cases. Prazosin effectively reduces trauma-related nightmares and sleep disturbances with 70% response rates, while ketamine shows rapid antidepressant effects for severe PTSD-related depression. MDMA-assisted psychotherapy, pending final FDA approval, induces enhanced therapeutic processing with 88% efficacy rates, avoiding the prolonged treatment duration that previously deterred many patients from therapy engagement. Medication effectiveness varies significantly between individuals, often requiring adjustments in dosage or switching between different classes to find optimal results. Most people experience substantial improvement within 8 to 12 weeks of starting appropriate medication. Side effects, when they occur, are typically mild and manageable, including initial nausea, sleep changes, or sexual side effects that often resolve or can be managed with dose adjustments. Holistic and complementary approaches. Integrative treatment approaches, combining evidence-based trauma therapy with complementary interventions, show enhanced effectiveness for PTSD recovery. Recent studies prove that regular yoga practice can reduce PTSD symptoms by 45% through nervous system regulation, body awareness enhancement, and trauma release. Regular movement practices, particularly trauma-sensitive yoga, produce powerful healing effects by reconnecting survivors with their bodies safely. Mindfulness-based interventions provide practical tools for managing intrusive thoughts and emotional dysregulation while building present-moment awareness. EMDR combined with somatic approaches shows significant benefits for processing stored trauma, particularly when combined with traditional talk therapy. Nutritional support, including omega-3 supplementation and inflammation-reducing diets, supports overall brain health and may enhance treatment effectiveness. Community and peer support approaches have proven incredibly effective in providing connection and validation that trauma survivors often desperately need for healing. These approaches recognize that trauma affects the whole person and that healing requires addressing spiritual, physical, and social dimensions. The combination of evidence-based therapy and complementary approaches often produces better outcomes than either approach alone, offering multiple pathways to recovery and post-traumatic growth. OTC items that can be of help. Several over-the-counter supplements can provide supportive benefits for PTSD management when used alongside professional treatment. Omega-3 fatty acids help reduce inflammation and support brain health, particularly beneficial for people experiencing cognitive symptoms or treatment resistance. Magnesium and L-theanine show promise for sleep and anxiety symptoms through nervous system calming effects. Ashwagandha and rhodiola show promise for stress hormone regulation and resilience building through adaptogenic properties. Research suggests that vitamin D and B-complex vitamins play direct roles in mood regulation and nervous system function, supporting the use of targeted nutritional interventions. Melatonin has evidence for improving trauma-related sleep disturbances, though these should be discussed with healthcare providers to ensure appropriate timing and dosing. Aromatherapy products like lavender or chamomile can provide immediate calming effects during flashbacks or hyperarousal episodes. These supportive measures work best as part of comprehensive trauma treatment plans, rather than standalone solutions for PTSD symptoms. Self-help strategies. Empowering self-help strategies provide immediate tools for managing PTSD symptoms while building long-term resilience and recovery skills. Grounding techniques quickly interrupt dissociation or flashbacks and can be used anywhere symptoms arise. Progressive muscle relaxation helps release trauma-related tension and reconnect with the body safely. Cognitive restructuring techniques include challenging trauma-related negative beliefs, developing balanced thinking patterns, and building self-compassion practices. Creating trauma-informed daily routines provides stability and predictability that reduces hypervigilance and anxiety. Regular self-care practices, consistent sleep schedules, and gentle physical activity support overall nervous system regulation. Gradual exposure to avoided situations helps overcome trauma-related avoidance behaviors that maintain PTSD symptoms. Keeping trauma journals helps identify triggers, track progress, and process difficult emotions safely. Building supportive relationships and maintaining meaningful activities prevent isolation and provide natural healing experiences. These strategies complement professional treatment and provide sustainable tools for long-term PTSD management and post-traumatic growth. Supporting loved ones. Supporting someone with PTSD requires understanding, patience, and knowledge about trauma-informed approaches that truly help, rather than inadvertently causing re-traumatization. Listen without judgment and avoid pushing them to get over it or share trauma details before they're ready, as this can increase shame and avoidance. Instead, acknowledge their courage and ask how you can best provide support during difficult moments. Learn about their specific trauma triggers and symptoms, and respect their need for safety measures while encouraging gradual healing rather than rushing recovery. Offer practical support like helping with daily tasks during difficult periods, providing transportation to therapy appointments, or simply being present without trying to fix their experience. Encourage professional treatment while avoiding becoming their therapist or trying to process their trauma yourself. Maintain your own well-being and seek support to prevent secondary trauma and caregiver burnout. Support groups for family members and friends of trauma survivors provide valuable resources and connection with others in similar situations. Celebrate small steps and healing milestones, understanding that trauma recovery is often non-linear with natural ups and downs rather than steady progress. Prevention strategies. Building resilience and implementing prevention strategies can significantly reduce PTSD risk and support recovery in those with previous trauma exposure. Regular stress management, trauma-informed self-care, and maintaining strong social connections create a foundation for psychological resilience and trauma recovery. Developing healthy coping skills early helps people navigate difficult experiences without developing chronic PTSD symptoms. Maintaining meaning-making practices, spiritual connections, and purpose-driven activities provides natural buffers against trauma's negative impact and supports post-traumatic growth. Learning to identify and address early trauma symptoms before they become entrenched prevents the development of chronic avoidance patterns that maintain PTSD. Regular mental health check-ins and maintaining therapeutic relationships help prevent symptom escalation after new stressful events. Early intervention immediately following trauma exposure, when acute stress symptoms are present, can prevent progression to chronic PTSD. Education about normal trauma responses helps people recognize when symptoms require professional intervention and seek help promptly. Building emotional regulation skills, communication abilities, and community connections enhances protective factors and reduces vulnerability to trauma's long-term impact. These prevention strategies benefit everyone, regardless of trauma history, by promoting overall resilience and mental health. Subscribe now to join thousands getting reliable health information that improves lives, as knowledge is your best medicine, and we hope you've gained valuable insights from this video series. Make sure to subscribe and like this video. It helps us create even more valuable health tips for you and others. Don't forget to share with anyone who would find this useful. Also, please comment below with any questions or topics you'd like us to cover next. Stay informed, stay healthy,